It's a lesion.
And the big green thing in the middle of the bigger blue thing on a map is an island. I was hoping for something a bit more creative.
Shouldn't we be speaking to the patient before we start diagnosing?
Is she a doctor?
No, but
Everybody lies.
Dr. House doesn't like dealing with patients.
isn't treating patients why we became doctors?
No, treating illnesses is why we became doctors. Treating patients is what makes most doctors miserable.
So you're trying to eliminate the humanity from the practice of medicine?
If we don't talk to them, they can't lie to us. And we can't lie to them. Humanity is overrated. I don't think it's a tumor.
First year medical school, if you hear hoofbeats, you think horses, not zebras.
Are you in first year medical school? No. First of all, there's nothing on the CAT scan. Second of all, if this is a horse, then her kindly family doctor in Trenton makes the obvious diagnosis and it never gets near this office. Differential diagnosis, people. If it's not a tumor, what are the suspects? Why couldn't she talk?
Aneurysm, stroke, or some other ischemic syndrome?
Get her a contrast MRI.
Creutzfeldt-Jakob disease?
Mad cow.
Mad zebra.
Wernicke's encephalopathy.
No. Blood thymine level was normal.
Lab in Trenton could have screwed up the blood test. I assume it's a corollary of people lie that people screw up.
Redraw the blood tests and get her scheduled for that contrast MRI ASAP. Let's find out what kind of zebra we're treating here.
I don't feel so good.
It's all right. Just try to relax.
Rebecca? Rebecca? Rebecca! Get her out of there.
She probably fell asleep. She's exhausted.
She was claustrophobic 30 seconds ago. She's not sleeping. We gotta get her out of there.
Just be another minute.
She's having an allergic reaction to the gadolinium. She'll be dead in 2 minutes.
Hold her neck.
Oh, she's ashen.
She's not breathing. Epi 0.5.
Come on. I can't ventilate.
Too much edema. Where's the surgical airway kit?
Yep, coming.
Good call.
Steroids. Give her steroids. High doses of prednisone.
You're looking for support for diagnosis of cerebral vasculitis.
Inflammation of blood vessels in the brain is awfully rare, especially for someone her age.
So is a tumor. Her SED rate is elevated.
Mildly.
That could mean anything or nothing.
Yeah, I know. I have no reason to think that it's vasculitis, except that it could be. If the blood vessels are inflamed, that's going to look exactly like what we saw in the MRI from Trenton County. The pressure's going to cause neurological symptoms.
Can't diagnose that without a biopsy.
Yes, we can. We treated her. If she gets better, we know we're right.
And if we're wrong?
We learn something else.
I can't see. I can't see.
Little help in here!
It's not a tumor. She's getting worse too fast. She can't stand up.
No toxins, no medications?
Nothing that would explain these symptoms.
Family history of neurological problems?
Not that I can tell from her underwear drawer.
You said nothing that would explain these symptoms. What did you find that doesn't explain these symptoms?
Dr. Wilson convinced you to treat this patient under false pretenses. Adler's not his cousin.
That's ridiculous. You can ask her yourself. Can we get back?
She's not Jewish.
Rachel Adler's not Jewish.
I had ham at her apartment.
Dr. Foreman, a lot of Jews have non-Jewish relatives, and most of us don't keep kosher. I can see getting through high school without learning a thing about Jews, but medical school?
Okay. Maybe she's Jewish, but she's definitely not your cousin.
Really? This guy's...
You don't even know her name. You called her Rachel. Her name is Rebecca.
Yes, her name is Rebecca. I call her Rachel.
You idiot! Listen, he's not you. Him. You said you didn't find anything.
Everything I found was in
You
my...
found ham. So, where there's ham, there's pork. Where there's pork, there's neurosis to cirrhosis.
Tapeworm? You think she's got a worm in her brain?
It fits. Could have been living there for years. Never occurred to me
Millions
because...
of people eat ham every day. It's quite a leap to think that she's got a tapeworm.
Okay, Mr. Neurologist. What happens when you give steroids to a person who has a tapeworm?
They get a little better and then they get worse.
Just like Rebecca Adler did.
In a typical case, you don't cook pork well enough, you digest live tapeworm larvae. They got these little hooks, they grab onto your bowel, they live, they grow up, they reproduce.
Reproduce? There's only one lesion and it's nowhere near her bowel.
That's because this is not a typical case. Tapeworm can produce 20 to 30,000 eggs a day. Guess where they go?
Out.
Not all of them. Unlike the larvae, the egg can pass right through the walls of the intestines into the bloodstream. And where does the bloodstream go?
Everywhere.
As long as it's healthy, the immune system doesn't even know it's there. The worm builds a wall, uses secretions to shut down the body's immune response and control fluid flow. It's really very beautiful.
As long as it's healthy. So what do? Call a vet, nurse the little guy back to health?
It's too late for that. It's dying. And as it dies, this parasite loses the ability to control the host's defenses. The immune system wakes up, attacks the worm, and everything starts to swell, and that is very bad for the brain.
There could still be 100 other things. The eosinophil count was normal.
It's only abnormal in 30% of cases.
Proving nothing.
Oh, no. You see, it fits. It's perfect. It explains everything.
But it proves nothing.
I can prove it by treating.
No, you can't. I was just with her. She doesn't want any more treatments. She doesn't want any more experiments. She wants to go home and die.
I think we can prove it's a worm. It's non-invasive. It's safe. I'm not completely sure, but I thought of it.
What's the damn idea?
Have you ever seen a worm under an X-ray? A regular old, no contrast, 100-year-old technology X-ray. They light up like shotgun pellets, just like on a contrast MRI.
Which is the same thing as a CT scan, which we did, which proved nothing.
Worm's cyst is the same density as the cerebrospinal fluid. We're not going to see anything in her head. But Chase is right. He's right. We should X-ray her, but we don't X-ray her brain. We X-ray her leg. Worms love thigh muscle. She's got one in her head. I guarantee you there's one in her leg.
Hold still, Rebecca. This here is a worm larva.
So if it's in my leg, it's in my brain?
Are you looking for a guarantee? It's there. Probably been there 6 to 10 years.
Do I have more?
Probably. It's good news.
What do we do now?
Now we get you better. Albendazole.
2 pills.
Yeah, every day for at least a month with a meal.
2 pills?
Yeah. Possible side effects include abdominal pain, nausea, headaches, dizziness, fever, and hair loss. We'll probably make you keep taking the pills even if you get every one of those.